Welcome, Emily Fenn, to the Breast Cancer Podcast. We're so pumped to have you here to talk about health and fitness. Maybe do an introduction and tell us a bit about yourself.
Yes, absolutely. Thank you. So my name is Emily Finn. I am a physical therapist by trade. I got my doctorate of physical therapy from Northwestern University in 2014. My clinical passions as a physical therapist include cancer rehabilitation, pelvic health, and working with the athletic population. So from a career perspective, I am in administration full time. So I manage a surgical oncology practice for a major healthcare system here in Columbus, Ohio. I also am a certified Level I CrossFit coach. So
Wow.
I do participate in CrossFit, but I also coach at the gym that I am a member at as well. And I am in education for physical therapists. So I teach pelvic health specific continuing education for a national organization here in the country for pelvic health for all genders and various pelvic health diagnoses.
Wow. That's a lot. I don't think I realized the CrossFit piece. That's pretty impressive as well.
There are multiple levels of certification for coaches, and I have my level I certification through CrossFit. And my next goal is at the beginning of next year to get my level II.
Wow. That's great.
That's
So if I
wonderful.
was someone that wasn't exercising or doing anything, this would feel really intimidating talking to you because you're like a fitness guru is what it sounds like. Would you consider yourself that?
Um, I Yes, but so CrossFit is a piece of it, but also as a physical therapist, exercise is what we learn, and that's the avenue by which we help people heal. We look at movement and we address movement problems, and what I prescribe people is exercise. So from the standpoint of the education that I've had, that's where I would say the guru comes from.
Mhm.
Because as PTs, we are one of the professions that considers themselves movement experts.
I like that better. A movement expert. Very good.
Emily, can you talk specifically to the benefits of moving your body, exercising specifically for someone who is diagnosed with cancer?
Yes, absolutely. So exercise can be very, very helpful across all stages, really, of the cancer continuum. So prior to a diagnosis, exercise can be very helpful, really just from a prevention, overall health and wellness standpoint. And there really isn't any cancer that exercise doesn't help prevent. So there's the pre-diagnosis stage, but then talking to folks who have already been diagnosed, it's like, well, okay, I've been diagnosed. So now what do I do? No. Exercise can still be very, very beneficial. And there's a lot of data that supports this too. There have been a lot of studies, a lot of rigorous studies that have really taken a look at across different cancer diagnoses, but a lot in breast cancer too, what exercise during treatment and after treatment can do from the standpoint of quality of life, mental and physical health, aerobic capacity, strength, range of motion of all extremities. So there's a lot of benefit from that standpoint as well. And that's immediate survivorship, but then also long term and in the years after diagnosis too, because as we know as well in the literature, cancer comes with a lot of side effects and treatment comes with a lot of side effects that don't go away once treatment stops. And exercise is very helpful with managing those side effects. A big one is cancer-related fatigue. There is a lot of evidence out there that talks about how exercise, and it seems counterintuitive that exercise can help manage fatigue, but it is the number one non-pharmaceutical most effective strategy for managing cancer-related fatigue. So helping with side effect management, and then it also helps prevent recurrence of additional cancers. And that's the other piece that I really like to emphasize and focus on with people as well. Just because you've been diagnosed with one kind of cancer, we got to make sure that we're managing
Yeah.
the risk for other kinds of cancers too. So exercise is not only helping you in your current diagnosis, but then preventing additional diagnoses as well.
Yeah.
That's wonderful. And I think when I had first learned that, I was like blown away. I just had no idea how it
Mhm,
could benefit
mhm.
your body in the sense of cancer.
Right.
And sometimes I think exercising, if you're not used to it, if you're not doing it regularly, it can feel intimidating. So
Totally.
we talk a lot about in the podcast about being empowered and things we can do to empower ourselves. What are some small steps if someone's listening to this, they don't have a regular routine? What are
Mhm.
some small steps that we can begin taking, I put questions I wanted to ask you for myself that we can start taking to feel empowered, to get moving, to create an amazing habit? What are some things we could start doing?
Absolutely. So really remembering the definition of exercise, truly what the definition is, can be super helpful. So exercise is literally just dedicated time that you are moving your body in a certain way that is exertional for you.
Hmm.
You do not need expensive equipment. You do not need expensive exercise clothes, although they're super cute, right? Like you don't need a gym membership. You don't need all of these things that you might think that you need in order to exercise. Exercise could very much mean I have laundry to do today, and I am going to purposefully do all of my laundry together, and I am going to climb the stairs consecutive times to take my laundry upstairs. That's exertional. That gets your heart rate up. You're carrying something. And I mean, laundry is also tough to do too, right?
Yeah.
Another thing, yard work. Yard work is also very physically exertional. So maybe you don't spend an entire day doing yard work. You're very intentional to try to accomplish multiple tasks back to back. So you keep moving, keeps your heart rate up. It's a little bit exertional, and that's exercise. It doesn't necessarily have to be getting a gym membership and joining this whole program. And that's a great way to start. It can also be walking. Walking is such excellent exercise, and we walk and we have to walk for multiple tasks throughout the day. So I'm going to the grocery store. I'm going to make sure that I am walking pretty quickly as I go through the grocery store, a little bit faster than I might otherwise. That's exercise. It's planning it and being intentional about it. That's all you have to do.
I love that because it does sound so simple. And I will say, when I was doing yard work over the summer,
Mhm.
my exercise ring moved. Like it was,
Right?
like I was so surprised how many
Yes.
calories I burned and how much I
Yep.
was moving my body, just
Yep.
moving things around and,
Yep.
bringing a bag of mulch over, just little, I was like, wow, this felt really good. I
Yeah.
accomplished a lot.
That's awesome. And that's exactly it. That hits the nail on the head. Like things that we do throughout the day already, it's really just looking at them a little bit differently and approaching them a little bit differently. And that's exercise.
That's very interesting you say that, Emily. Like I have not thought of walking as an exercise because I'm sweating, but not like profusely sweating,
Right.
So
Right.
so mentally I haven't thought of it that way. But when I go for a walk, which I love walking, I
Mhm.
feel like if I have a stressful day, I feel so much better right after the walk.
Yes.
If I have a problem that I'm trying to think of solving, I don't
Mhm.
know, somehow like I get solution while I'm walking.
Yeah.
If I'm getting ready to give a talk and I'm trying to think of the outline for the talk, it just
Yes.
comes to me as I'm walking.
Great.
And so it's just, I just feel like it's such a great mental therapy for me.
Yes.
I don't know if I lose weight, but I feel so good after the walk is finished.
Mhm.
And so just this morning I woke up and I went, I do a walk run for a couple of miles. I'm also wanting to do the hot chocolate run up in November. So trying
I
to
wanna
get
go with
prepared.
you.
Yeah, we
That
should do it
sounds like- yeah,
together.
that
We
sounds
should do
like
it
You
fun.
together.
should.
Yeah. And so but I'm so happy to hear you say walking is exercise. I love that because anyone can do that, right? As long as we're able to. Yeah, we all can do that.
And I
Yes.
think what's interesting, Dr. Harvey, is you mentioned weight. Like you're not sure if you're losing weight, but we haven't even talked about that as,
Yes.
like, because yes, that's maybe another aspect of it,
Yeah.
but just being able to feel empowered, taking these
Yeah.
steps, feeling good. I remember someone telling me, I don't look at the scale, I look at how I feel.
Yeah.
And my friend I went to the gym with recently, she brought me as a guest. She's like, sometimes I don't want to go, but I have never regretted going once she's finished. And I think that's how exercise works. Like
Yeah.
it's
Oh,
doing
yeah.
it. And then
Yeah.
you're like, okay, I feel really good. And I'm so glad I did that. I don't think anyone ever regrets, man, that walk was awful.
Yeah.
Yeah.
Or that run.
Exactly. A large part of it is just getting there
Yes.
there and started.
And you feel so much better afterwards. Yeah.
100%.
Is there a recommended, this is where your heart, like I hear about in the zone, like, are you in the zone? Can we talk
Sure.
about that and how that relates to exercise?
what's recommended, and this is actually really, I think really interesting and also really great as well. So the recommendations for physical activity for cancer survivors are really not different or much different compared to people who have not been diagnosed with cancer before. So what's recommended is 150 minutes a week of moderate intensity aerobic exercise. And what's nice is that that moderate intensity is very scalable to the person, to a specific person. So I really like to use what's called the talk test. When someone is working at a moderate intensity, and this is what I always tell my classes when I'm coaching, the warm-up, for example. As you are moving through a warm-up, you should be able to easily talk to me. So as you're moving, as you're getting going, we're getting the heart rate up, but not so exertional that you can't speak, or that it's very, very difficult for you to speak. So we like, from an intensity standpoint, looking at moderate, that's about 60 to 70% of maximum heart rate for a given person. There's a lot that goes into heart rate calculation in terms of what's appropriate for a given person. So I tell people, utilize that talk test when you're at your moderate intensity. You should be able to talk, not very, very easily, because we want there to be challenge, but you should be able to speak 3 to 5 words at a time without breaking, because you're breathing so quickly and so exertionally. So that's something that I like to educate people about in terms of monitoring their own intensity. Another thing that you can utilize is a number scale. So 1 to 10, 1 is how you feel when you wake up in bed in the morning, and very, right, like very calm, hopefully very calm, peaceful, have had a good night's sleep. 10 is the hardest you can imagine working. When you are exercising, I want you between a 5 and a 7. That's where we're looking. And so kind of on that number scale too, that can help people. And it's really nice. Those measures, they're seemingly subjective, but again, they've been grounded in the research, because for people with certain diagnoses, like for cancer survivors, for example, what the standard heart rate calculation might not be appropriate or truly reflective of the heart rate you should be working at, depending on the side effects and the treatment that you've gone through.
So, I read Dr. Peter Attia's book called Outlive. I don't know if you read that or not. He talks a lot about the zones. So he says, in order to lose weight, you need to be in zone 2.
Okay.
How do you describe zone 2?
So in terms of, that's looking more so from a weight loss and like a fat burning standpoint. That is what I was just talking about, the zone that you want to be in, that percentage. So it's looking a little bit more at lower heart rate, longer, like more endurance workouts.
Okay.
Versus the higher intensity, shorter bursts of energy.
I see.
Really looking at like the 80% max heart rate and higher than that. That's really getting into the lactic threshold. And that's a specific type of training. Like I think often about Olympic weightlifters or power lifters, like the athletes they're picking up a lot of weight, and they have to generate force very, very quickly in order to complete their task. That is more so in that lactic threshold. You're not biologically stimulating the process for fat loss and weight loss. That's at a lower heart rate, kind of longer duration, more endurance-based exercise. Yes.
Okay. That makes sense.
I think I want to go back to the weight thing though, because being overweight does put you at risk
for developing or breast cancer as well as recurrence. Yeah,
exactly.
Yeah,
so,
especially in the postmenopausal time.
Yeah. So I think it's great to keep that in mind, as well as another benefit, because you want, if you want to lose weight, you want to reduce your risk.
Yeah.
This can also help as well. It's kind of like, again, empowerment. I want to lose weight. So that's an aspect of it if someone wants to.
Right.
And then because you're losing weight, you're reducing your risk, but then just exercising generally, you're still reducing your risk. Does that sound right?
I always say not just reducing the risk of cancer coming back, but also heart disease and, Alzheimer's, obesity, metabolic syndrome, diabetes, and all the different complications that go with that, stroke.
Absolutely.
And so it helps in so many different areas, just overall quality of life.
Can you speak to why weight is a risk factor?
Well, when you have excess adipose tissue, especially for breast cancer, for those women who are hormone receptor positive breast cancer, estrogen tends to be deposited in the adipose tissue.
Adipose tissue,
which is the fatty cells.
Break it down for me,
yes.
Dr.
Yes. No, thank you for asking. Yeah. So I sometimes forget that I'm not talking to medical people. But yeah, so it's estrogen is stored in your fatty tissue. And so that can feed the breast cancer. So it's important. And also for diabetes and all the different complications that can come from diabetes
Okay.
can also result as a result of, excess weight.
So if I understand it correctly, if I have a lot of fat or someone has a lot of fat, my cancer was estrogen positive, meaning
Yes.
it fed off of estrogen.
Right.
Estrogen can be stored in the
Yeah.
fat tissue in your body, and that's what we don't want. We want to eliminate as much
Correct.
estrogen as
Correct.
possible.
Yeah.
Okay. Okay.
And the hardest thing, Emily, is, as breast cancer patients go through menopause, we have young patients who go through menopause as a result of this diagnosis. Now it's super hard for these young women in their 30s and 40s. And, menopause usually doesn't happen till your early 50s, but we're putting these young women in menopause. That has really been challenging. And I hear almost all my patients complain about that, about the difficulty in losing weight. Do you have any tips or tricks for these women?
That's a great question. And so from the standpoint of exercise, and I've heard a lot in my PT career, it's an interesting dichotomy. Patients come to me and say, I've been told that I don't have any restrictions. I can do whatever I want. And that's terrifying. So on the one hand, it's great to hear like we're through treatment. Go for it. Do whatever you want from an exercise perspective. But for some patients, that's like, oh my gosh, what does that mean? Where do I start? How do I begin? What type of exercise should I be doing? So talking about different kinds of exercise, we've talked about aerobic, walking, running, more endurance-based activities, but strength training is also really, really important as well. So within those exercise recommendations, that also includes 2 to 3 days a week of resistance-based exercise. And I've had a lot of patients too who have had questions about that, and they're concerned about what exactly they should be doing, especially if they're post-surgery, if they've had a mastectomy, any kind of mastectomy, lymph node removal, anything. Is this safe for me to do? And it's so wonderful that the answer is yes. And there is a lot of research out there to support the benefits of resistance training for patients who have had breast cancer and who are post-surgical, and with patients who have lymphedema as well. Exercise and resistance training is not a risk factor for worsening lymphedema. It can actually be very helpful. Resistance training can also be really helpful to promote optimal bone health, which is an unfortunate consequence and side effect of going into menopause, compromised bone health. And then also in the pelvic health world, looking at exercise and what it does from a hormonal perspective. Actually, women who exercise consistently every week, their likelihood of developing estrogen-related pelvic health dysfunction, such as endometriosis, decreases. So from a hormonal perspective, exercising in a variety of different kinds of exercise can be beneficial for those patients who have hormonal considerations and who are in that menopausal state. One thing that I do want to say as well, from a weight perspective, and Dr. Harvey, you talked about adipose tissue. I think it's really important to remember that weight and the number on the scale is not what's important. What makes up that number on the scale is what's important. And we need to keep that in mind. And I think women especially, but also men, I know this impacts a lot of men as well. Don't be so focused on the number. What's making the number? And so it is great and it is wonderful to lift weights and to develop muscle and to feel good and strong in your own body. And the numbers will follow as you are participating in a regular exercise program, eating, focusing on the nutrition that you should be consuming. That all kind of falls in line. And all of those things as well are very, very helpful for mitigating those menopausal side effects, especially for patients who are younger.
Yeah, I will say you're talking about adipose tissue and weight. So I love strength training. That's one of the things that I enjoy the most. And I started incorporating strength training, I would say 4 years ago. But I will say one thing that's kind of discouraging, and I'm glad you brought that up, is when you start lifting weights, your weight goes up on the scale, right? Because you're losing the fat, but you're gaining muscle, but muscle weighs heavier than fat. And
Yes.
that's something that I have to keep reminding myself, because it can be discouraging to see that number on the scale.
Right.
But seeing how your clothes fit and how you feel. And I think those are, some indicators to know that it's actually working. So
Yes, definitely.
Emily, is there such a thing as working out too much?
That's a great question. And
Yeah.
yes, there is. So overtraining is absolutely something that is it's pretty common actually, across multiple ages, across multiple, looking at various diagnoses, not just within the cancer population, but outside as well. It is possible to overtrain. And so that's actually something that sometimes I need to remind myself, like, we need rest days. We need days where we are not necessarily, and I don't mean rest by like laying on the couch all day. I mean rest by not necessarily intentionally exercising. And that's okay, because our body needs that. Our body needs that time to recover, to rebuild and grow muscle. And that's 100% okay to do. When it comes to, and so this is also something that I focus a lot on with patients from the perspective, I talked about fatigue earlier, especially for people I found who are going through treatment. Every day can be wildly different from the previous day. So you might have the best of intentions to exercise, you might have a whole plan, but depending on how you wake up feeling that morning, it might all just not be possible. And we do need to be very mindful of that and listen to your body. If it feels like too much, if it seems like too much, it probably is, but we still want to get movement in. So I think it's really, really important to have different kind of categories of what exercise might look like for you. So you can still do something, so you can still move, but it's going to be based on how you feel that day. So maybe it's a treatment day or it's the week of treatment. You know what? You feel really fatigued that week, feel not the best. Maybe those weeks you just don't go on walks or you don't do resistance training. We already take that out of the equation. But you know what you can do? Maybe you do some deep breathing. Maybe some gentle stretching. Maybe you do yoga poses. Flexibility, that's a type of exercise as well. And it's stretching is a very important type of exercise too. So you can scale what you're doing and the intensity of what you're doing to meet your body where it's at. Because if you overdo it, if you're overtraining and you're not giving your body time to catch up and to rebuild from what we've done with the exercise, that's not good either.
Can you explain why that's not good? What happens to your body when you start to push it beyond its limits?
Sure, absolutely. So physiologically, when we're exercising, we're actually breaking down muscle tissue at the microcellular level. We're essentially tearing up the muscle. And what that does is it stimulates regrowth, but then additional regrowth. So that's how muscles grow. We call that muscle hypertrophy. And the cells that are in the muscle called sarcomeres, they're rebuilding and kind of layering on top of one another. So we're creating breakdown for there to be overall growth. When we get into a state of overtraining, and it's actually called overtraining syndrome, it's a diagnosis, it's a syndrome that can be diagnosed. We are stimulating that breakdown over and over and over and over again until the body is in such a state of depletion that we can't get ahead. So that growth that should be happening, it never gets a chance to catch up because that breakdown is going at too high of a rate, if that makes sense. The other thing that overtraining syndrome can encompass, it's not just at the muscular level, but really the entire body from a hormonal perspective, like female athlete triad, if you've ever heard of that term in the context of primarily female athletes, like at the teenage, preteen level. But when they are overtraining, when they're exercising too much, that has implications for skeletal health, for thyroid function. It's really a whole kind of multi-layered condition that can happen. So that's why we need those days where we're not exercising as intensely and where we're resting so that growth can catch up and exceed the breakdown.
That makes sense.
Wow.
I don't think I would have that problem, but I could see how someone could be like, oh my gosh, I want to reduce my risk as much as possible. So I'm going to push myself. And
Right.
that could be dangerous. Like you don't want them to get to that point.
Correct. So we want people to be exercising regularly, but it doesn't have to be the same intensity or the same type of exercise each time. It's not that it has to, and again, this is even for people who've never been diagnosed with cancer. It doesn't have to be high intensity every single time. In fact, it shouldn't be.
So let's say we have a listener out there that they're like, I want to start exercising. I'm going to start tomorrow. I've learned so much information. I'm going to share it with people. What's like one step you can tell them to do tomorrow after listening to this podcast to get them going towards their exercise routine?
Sure. So I would take that back to what we talked about earlier in terms of look at what you do throughout the day and how can you make it a little bit more challenging for yourself. So I talked about going to the grocery store and walking a little bit more quickly through the grocery store. But let's say tomorrow you have to take your kids to activities. Don't park so close to wherever you're dropping your kids off. Park farther away in the parking lot and walk with them. Yeah. Let's say you have to go to an appointment tomorrow and you usually take the elevator in the building that your appointment's at, or your office building has elevators and you normally take the elevators. Don't take the elevator either at all, or maybe now if you're in a skyscraper, that's a different story, of course, but maybe take the stairs for a couple of levels and then get on the elevator. Do something that you might not otherwise do, because physiologically that kickstarts the body from an exercise perspective. And it's also super interesting in the research how someone who goes from being relatively sedentary or doesn't exercise regularly, if they do something as simple as starting to walk a little bit more every day, physiologically, the charts, like the benefits literally are off the charts. And then once you start to exercise more regularly, that benefit kind of plateaus. And so you have to work a little bit harder, so to speak, in order to achieve the same benefit. But you are going to get so much out of by simply starting to move more. And that moving more doesn't have to be at a gym, and it doesn't have to be in the context of a workout program. It's just doing a little bit more than you might otherwise would.
And I like what you said about setting that intention first. So maybe plan a day ahead, and here's what I have on my schedule tomorrow, and here's what I'm going to do when I take the kids somewhere or go grocery shopping. I have a plan set up, versus just like trying to do it in the moment because you may forget, like, oh shoot, I missed an opportunity.
Right. Or in the moment as well, it can be a little intimidating to figure out, like, oh my gosh, what am I going to do? Thinking about that ahead of time can be really helpful to take away the stress and concern associated with that.
You are probably also talking about NEAT, right? NEAT, NEAT, non-exercise activity time. Yes. I feel like, like sometimes on a weekend, I work out for an hour. The rest of the time on the couch, reading a book or watching TV or on my phone. And I'm thinking, okay, Deepa, you're not really helping yourself by doing this. And so I have read studies where they talk about NEAT when you're not exercising, how active you are. And I think that's exactly what you're talking about, is being active at those other times when you're not physically, exertionally working out. Exactly. And that's very important, right? To get the steps.
100%. Yeah. 100%. Yes.
Emily, are there any groups out there nationally, internationally that people could look up to join some type of cancer exercise fitness group?
Great question. So those groups can vary locally. So the first thing I always encourage people to do is talk to your provider and ask what resources are available within your healthcare system. Who can they connect you with from a survivorship standpoint? Canceradvocacy.org, cancer.net, and ACS, so American Cancer Society.org, also has really great resources on their websites based on where you live. You can enter the part of the country that you live in and see kind of what's available from a survivorship perspective. And what I do also encourage people doing, if there locally is an exercise program that they're looking to join or something that they're interested in, reach out to that gym, the facility, whoever creates the program first. course, if you feel comfortable, but explain kind of where you're coming from. Explain your background. Like, hey, I have been treated for breast cancer. This is where I'm at right now, and these are what my goals are. Do you have any experience with working with people like me? Or do you have any recommendations for something or anything that I could do to make sure that this is the best experience for me as well? One of the things that I would always do as a PT when it got to that point where patients were ready to exercise on their own, but there were some things that we needed to keep in mind just to make sure that it was the safest experience for them, I would reach out to their personal trainer, their gym, whoever they were working with, and just have a quick communication and just say, hey, this is what we are avoiding. This is what we're focusing on. Maybe these types of movements might not be the best, and this is what you should focus on. So giving people kind of an outline of, hey, this might not be so great, but this is what you should be doing, can be helpful too. So reach out and ask the questions. Doing that in advance can be really helpful.
This has been wonderful. One last question I have for you is,
Yeah.
how many days a week should one do endurance type of exercise and strength training and stretching?
Great question. So 5 days a week is typically what's recommended. Now there's flexibility, literally and
No.
figuratively,
Right.
within that as well. But I mentioned the 150 minutes. So
Yeah.
that typically breaks down to about 30 minutes, 5 days a week. But as I mentioned, how someone might be feeling if they're in treatment or experiencing side effects of treatment, that might not be feasible. So you can break up that amount of time throughout the day. It doesn't have to be 30 consecutive minutes. It might be 10 minutes of stretching. It might be going on a walk for 10 minutes later on that day. Or it just might not be the full 30 minutes, and that's totally fine. Something is better than nothing. Always. Something is
Right.
better than nothing. So 5 days a week is a guideline, but that can range 3, 4, 5 days. I tell people consistency is what's key. As long as you're doing something a couple of days a week at least, you'll be fine.
So would you say 2 days of like endurance exercise, 2 days strength training, and 1 day of
Yes.
stretching? Okay.
Yep.
Okay.
The variability keeps things interesting.
Right.
And you don't feel like you're doing the same thing every day. And that's what I tell people, switch it up. Maybe one day when it comes to resistance training, one of your days is upper body, your other day is lower body, and then the other 2 days are endurance. And that might look like a walk. That might look like getting on a machine at the gym, really whatever works best for you. And then yes, your 5th day is focusing on stretching and mobility.
One of the things I was going to ask you is why cancer? Like why is cancer important to you?
So when I first started as a PT, pelvic health was my big focus, and cancer kind of came along after that. And I really didn't know much about cancer rehab when I started off in my career. And one of the things that I used to always say about my family, both sides of my family, we have a heavy heart history on both sides. So a lot of cardiovascular things. And one of the things I always used to say is we're a heart family, we're not a cancer family. So professionally, that translated to me like this is a population that I really can't relate to on a personal level, but I want to help because I know that it's so important. And so that's why, I'm here for a reason. We're all here for a reason. And I just feel like this is somewhere where I can be impactful. I have no personal experience. I don't know all of these things that I talk about. I don't know what it's like personally, but I'm here to help and I want to help. And that all changed when my dad was diagnosed with cancer a few years ago. And he actually has 2 types of cancer. Now he has testicular and prostate cancer. When they found his testicular cancer in 2020, it was metastatic. So it was an abdominal mass that was found.
Wow.
Yeah. And so it was kind of working backwards because it went through this journey of what kind of cancer is it? Very non-specific. He had that mass removed actually on New Year's Eve in 2020. So the last day of 2020.
Wow.
He was diagnosed with prostate cancer the following year, and his testicular cancer is back, and he's actually having surgery tomorrow.
Oh, wow.
So
Okay.
now I I'm not one of those people who's speaking from non-experience. I'm speaking of experience of having someone in the family with cancer, and it's even more important.
Oh,
Well, we are
So-
sending you, sorry for the
yeah, sorry.
question.
Yeah.
No. Don't apologize. Actually, this timing was perfect.
I appreciate you sharing that with us. And it makes me always feel like you're doing exactly what you need
Yeah.
to be doing.
Yes.
Even though you
Yeah.
came from the Hart family,
Yeah.
the focus on cancer and
Yeah.
and helping others and just being in that awareness, like this bubble of cancer and being able to speak
Yeah.
our language,
Yes.
your dad's language, unfortunately.
Yeah.
But we are sending all of our love
Yeah.
to you, to your dad, to the cancer community, because
Yeah.
it's never easy.
Right.
As much as you may talk about it and see patients,
Yeah.
it's so different going through it yourself and,
Yeah.
and someone you love. So we are sending all of our big love that
Yeah.
we have
Thank
to you and your family.
Yeah.
Thank-
Thank you so much for taking the time in spite of the fact that he has surgery
Yeah,
tomorrow.
I didn't realize that. I probably
Yeah,
would. Had I
so
known that,
thank
I
you.
would have scheduled it.
Yeah.
Oh my
yeah.
gosh. No. Not like I said, this timing was actually perfect. I'm very, very glad that I was here today.
Thank you so much, Emily. You're so kind, and thanks for taking the time to be here and such great information for our, for our listeners.
listeners,
Yeah.
Thank you so much for having me. This has been wonderful. Appreciate you both.
That was awesome. I love this.
Oh my gosh, she's phenomenal, isn't she?
Yeah.
And there's so many benefits to exercising, not just decreasing the risk of cancer coming back, but like we talked about, heart disease, diabetes, metabolic syndrome, Alzheimer's. And I know you and Emily are babies, but me, I'm getting older. So I also think it helps with aging, and
Well, I have osteoporosis.
yeah.
So like on the inside, I feel like an old soul, like
Yeah.
my bones are old, but I know that walking helps the bone
Yeah.
strength, like she mentioned, resistance training as well. And I walk, like I act like I don't, but I do walk, but I always feel like it's not enough. I
Yeah.
could be doing more,
Yeah.
but just hearing her say, like setting that intention,
Yeah.
walking is exercise. Don't be
Yeah.
hard on yourself.
Yeah.
And I think, just if it seems like it is intimidating, just take small steps, like
Right.
10 minutes,
10
or the
minutes a
grocery
day.
store, like she said, or
Yes.
the laundry, just set that
Yes.
intention.
Yes.
I don't think you're going to lose at all when
Yeah.
you set the intention and want to exercise.
I think the important thing is to, even when you don't feel like it, to get up and doing it. And that happens to me more often than not,
Mhm.
where I do not feel like I want to work out, but
Yeah.
after I work out, I feel amazing. But like you said, yes, it doesn't have to be a marathon or anything like that. It's just 10 minutes at a time.
Yeah. I forget where I saw this or read this, but it's talking about motivation, and motivation just doesn't happen. It's the action
Yes.
that then gives you the motivation to continue. But you
Right.
really have to force yourself, if you're not one to exercise, just to
Yeah.
do
Yeah.
it. And then that motivation will
Yeah.
start. And then
But also in addition to all those things, the benefits of exercise, such a great mood booster, decreases, anxiety, depression,
yeah.
and just so many benefits to exercising. There's really no side effects.
Yeah,
and
that's
I think
what
that's a beautiful thing.
unless you
So,
do it too much. So don't.
yes. Yeah,
do it
there's
too
such a
much.
thing
Don't
as working
overdo it.
out too much.
All right. Well, we hope this episode was helpful to you. We hope you feel motivated to take some small steps, or if you're already exercising, to keep going. So that's it for today.
Awesome. Take care, everyone.
Bye.
Bye.